The short answer is yes, they can, but not always. In this video, you're going to learn all about post-SSRI sexual dysfunction, or PSSD, what it is, what medicines cause this, how often it happens, and what medicines you can use instead to avoid this. PSSD means sexual dysfunction that continues even after stopping an antidepressant medication. And of course, we know that many antidepressant medications can cause sexual dysfunction, maybe about 50 to 60% depending on the medicine, but PSSD is specifically sexual dysfunction that continues even after stopping the antidepressant. Some of the signs include erectile dysfunction, difficulty with arousal, difficulty with orgasm, and low sex drive. And what causes this? Well, it's medicines that increase serotonin, like selective serotonin reuptake inhibitors. Some examples of these: Zoloft, Lexapro, and many others. You might be wondering, how likely am I to get this permanent sexual dysfunction? Well, a 2023 study looked at this, and it was a cohort study, meaning it was an observational study. They looked at 12,000 males ages 21 to 49 years with erectile dysfunction. And they specifically were able to tell this because these males were being prescribed phosphodiesterase 5 inhibitors for erectile dysfunction, like Viagra. The overall risk that they found of taking antidepressant and developing this long-term sexual dysfunction was an odds ratio of 3.2. And that means you're over 3 times as likely to develop this erectile dysfunction if you had taken an antidepressant previously. That means you're over 220% more likely to have this erectile dysfunction if you had taken an antidepressant. What they found was 4.3 cases per 100,000 men. This comes out to 0.46%. So it is low, but it does happen. Of course, there were some limitations to this study. They only focused on erectile dysfunction. They didn't focus on other forms of sexual dysfunction, like low sex drive, difficulty with arousal, difficulty with orgasm. And they also only measured the erectile dysfunction happening with the prescriptions of these PDE5 inhibitors. So what medications can you take for major depressive disorder that don't cause any sexual dysfunction or cause very little sexual dysfunction? Well, let's look at it. It's mainly medications that don't increase serotonin or don't increase it very much. Some examples of these: bupropion, no sexual dysfunction. Auvelity has dextromethorphan and bupropion. Dextromethorphan, part of its mechanism is it's a serotonin reuptake inhibitor. So that one, I've done another video on that. I'll put that on screen here. Has about a 6% chance of sexual dysfunction. Desvenlafaxine is a norepinephrine serotonin reuptake inhibitor. So it does work a little bit on serotonin, but it works more strongly on norepinephrine. Mirtazapine has a complex mechanism, but doesn't seem to cause sexual dysfunction. Same thing with nifazodone. And these last two I put here cause sexual dysfunction less: duloxetine and vortioxetine. But sexual dysfunction still happens. Sexual dysfunction is a big concern for a lot of people, and most people know that certain medicines can cause this. Something most people don't know is that certain antidepressants can cause a potentially permanent abnormal movement disorder called tardive dyskinesia. So click on the video on screen right now to learn all about it and stay informed.